Hey there, Sono Peeps. How's it going? Henry here. We're going to go over a venous Doppler, lower extremity, right side on the GE LOGIQ E10. So that's a brand new machine we just got. It's got the radiant flow. I'm going to use radiant flow throughout here. You're going to see me change pretty much all the transducers. I wanted to really put it through its paces. I took a lot of images. Usually I don't take this many, but I usually try to interrogate all these vessels. So we'll start at the beginning. I'm using the C16, the curved probe, on an abdomen type setting at about 4.5 megahertz. And this is the IVC right here. I went and changed it to the vascular setting, and it made it much nicer because the focus is the vessels, not the internal abdominal organs. So here you got your IVC distal sag, a little bit of free fluid. We'll see what that's about later. So I'm pretty much going to go over the protocol as well. So sagittal, without color, with color. So you got your radiant flow, and then spectral Doppler. The augmentations, I start augmentations from the common femoral. Now, a lot of places about augmentations, they usually say to be aware of augmentations because you can dislodge a clot. So, but if you're in the common femoral and you try to do an augmentation and you can't, then it's a good idea to not augment and search to see if there's a clot. Sometimes there's edema that's stopping that from happening. But I begin the augmentations from the common femoral down. All right, so then this is mislabeled, supposed to be transverse. IVC distal transverse without color. So here you have your aorta and IVC, barely noticeable. A little bit of the vertebrae right there. And then with color, obviously makes it stand out. The radiant flow on this machine is just gorgeous. And then finally, I fixed the labeling. Transverse, you got your common iliac arteries, right and left. Common iliac veins, right and left. You see the left is kind of going traversing instead of being two perfect circles. And then with color, see that? Right common iliac artery, left common iliac artery, right common iliac vein, left common iliac vein. All right, so boom. Now we're in the right common iliac vein section in sagittal. You see there's some free fluid here, some ascites, and then this. So that's a peritoneal dialysis catheter. Usually when I see a catheter like that, I'll just, I already knew this patient had that, but if you don't, because sometimes you can have a VP shunt that is also a catheter in the abdomen. It's going to be some fluid. So you might have to ask some history on that. But I usually take a picture of the catheter and write what kind of catheter it is. If it's a VP shunt catheter or a PD cath, or if it's a PICC line cath if I'm doing an arm. Obviously, just a couple pictures from it. This is not the focus of the exam. The focus of the exam is to rule out deep vein thrombosis. So common iliac vein without color, with that radiant flow. And then, there's another one there because it's pretty. And then it was spectral Doppler. So once you're done with that, you want to go to the bifurcation or the confluence of the external internal iliac veins to the common iliac vein. All right? Well, actually, you got to take some transverse pictures of the common first. So common iliac artery, iliac vein, and that fluid. Without color, with color, and then we're done. So now sagittal, common iliac vein, external iliac vein, and internal iliac vein, and external iliac artery, and you can see that free fluid there again. Without color, with color, you can see this blood flow is going away from the transducer because the venous blood is returning towards the heart. So it's going to be encoded in blue. This blood vessel is going towards the common iliac vein. So it's going to be encoded in red. So it's good to know that that's not an artery. That's the iliac vein. So usually when I see that, I'll take a picture like that. And then I'll put a power Doppler with just one color because I like to see it all in one color. There it is. All right, so then external iliac vein, spectral Doppler, augmentation required, and then transverse, grayscale, fluid, free fluid in the abdomen, artery, external iliac vein, grayscale, with color. Look at that, beautiful. All right, so now I'm done with that. Now into the groin to do the common femoral vein. So I got to really tweak the settings on this machine. All the presets are a little, like this one, when you do a venous Doppler with a 9, now I've switched to the 9. It puts the setting at 6 megahertz, whereas this person not very big, you can start definitely on a 9 and get a clearer picture. So here you go, common femoral artery, common femoral vein, with and without compression. And we also now have to do, in our place, with and without compression, grayscale, and with and without compression with color Doppler. I know some places will do the compression and then they'll add a little caliper to where that compressed vessel is because it is hard to see when it's compressed. But now we got to do the extra images. So this is kind of a little lower from that region because here's you got your superficial femoral artery. and your profundus, and that's your common femoral vein. But there you can see is there, and then collapsed. So sagittal, grayscale, common femoral vein. Sagittal, color Doppler with the radiant flow, common femoral vein, and then sagittal, spectral Doppler with an augmentation. Done. So now you can do the saphenous vein. You can go from there to the saphenofemoral junction, but I found the saphenous vein first. It all depends on which one I find first. So I went to the great saphenous vein first, with and without compression. Dual screen. You can see this is all subcutaneous fat, so you know it's a superficial vein. The muscles start here, and then with color. And sagittal, greater saphenous vein, without color, with color, and then spectral. All right, so here you got your saphenofemoral junction. Here's your common femoral vein. Saphenofemoral junction could be here. I'm using that 24 megahertz transducer all the way up, so you're not really getting penetration here. It would probably be better with maybe the 15 or the 9. But either way, there it is. Here you can see a little clearer. Saphenous, great saphenous, saphenofemoral junction, accessory vein, and then you got your common femoral vein there. So that's without color, and then with color flow at the femoral junction. Look at that nice confluence there. Beautiful. That color flow is just, I like it a lot. All right, so, and then you can do a dual screen, and then one with color. All right, so now superficial femoral vein, proximal. So I'm starting here at the wording is out here on the outside of the box. So with and without compression. I know a lot of places or a lot of people say, oh, we don't use the word superficial femoral vein anymore, but everybody still does. So whatever. I know maybe 20 years down the line they'll eventually stop using it, but for now everyone still does. But femoral vein, I understand the confusion for some ordering doctors. Are like, oh, if it's superficial femoral vein, so is that a deep vein or superficial vein? So I understand the confusion, but we still use the term superficial femoral vein. So with and without compression, with color, with and without compression, sagittal grayscale, artery vein, color Doppler, and then spectral with pulse wave with augmentation. All right, so mid, superficial femoral vein mid, with and without compression. There's the artery there, and then the veins compressed there. With the color Doppler, you can see a little better. So it's not picking up flow in the artery because I'm still using, now I'm using the 15 megahertz transducer. I had switched. So if I used the 9, I probably would have picked up the flow in the artery. All right, so sagittal, grayscale, with color, that radiant flow, and then spectral Doppler. Distal, dual screen, with and without compression, with the color, and I also did one with a regular color because it just feels better. So one little tip, when you're doing the distal femoral vein, come here, you're going to have a hard time compressing it because the femur is there real close, and especially the patient's having pain. So what you want to do is come from the outside and push in this way, and it will collapse the vein. It works every time. I know a lot of you probably know that trick, but it's a very good trick to use, and I use it with this one. Otherwise, if you be compressing here, and that femoral vein will not compress. All right, so now, done with that. Actually, no. Superficial femoral vein distal without color, with color, and with spectral Doppler. And then finally, popliteal vein. Not finally, because I'm doing more than this. But this now I'm using the 24 megahertz transducer at 18 megahertz. Look at the striations in the muscle. It's just gorgeous. And I think you're getting a little, either this one or this one's the lesser saphenous vein, which comes off the popliteal. So here's your popliteal vein, artery, and then compressed. And with color, you can see it more clear. Artery, vein, compressed over here. Sagittal popliteal vein, grayscale. Look at that. All right, with radiant flow. Nice. And then spectral Doppler keeps on skipping it. Hello. Next. There, spectral Doppler with augmentation. So then finally you're done with that. You can start seeing the tibial peroneal trunk, which usually the artery is the easiest one to see. So here's your popliteal artery, tibial peroneal artery, and then the anterior tibial artery. And same thing with the vein. The vein follows the same thing. But when you put color Doppler, usually you can see the artery in grayscale much easier. When you put the color Doppler, you'll see it on the vein. So it's the chicken foot, was what I like to call it. Why is this going down so fast? So the chicken foot, because it's like that, the three vessels. So you have your tibial peroneal trunk, posterior tibial vein, peroneal vein, which is also the fibular vein, and then anterior tibial vein. So, usually, remember, your approach is medial, So you're coming medial in the calf. How far can I lift my leg? Medial in the calf. You're getting your popliteal here and your medial calf to get that view. So, but you're still approaching from the posterior. So the posterior vessel is going to be more anterior, and the anterior vessel is going to be more deep. So this is the posterior. And I usually always take several pictures because I love this view. So there you see that bifurcation. Tibial peroneal trunk. It can be very long on some people and very short on some people. And anterior tibial vein. Then I always put labeling for the radiologist just because they seem to like it. I've never had one that said don't do that. All right. So then I start Dopplering, spectral Dopplering. So I'll do this tibial peroneal trunk. See, I took several images with the radiant flow. It's just beautiful. Look at that, chicken foot. All right. So spectral Doppler there with augmentation, tibial peroneal trunk. Then I can start doing transverse with compression. So you have the anterior tibial veins with and without compression. Really hard to see. I can see why they prefer the color Doppler images because it really does stand out. So 2 vessels, 1 artery. Just like the brachial artery, you have 2 vessels, 1 artery, and the radial vessels, you have 2 veins, 1 artery. Ulnar vessels, 2 veins, 1 artery. So with and without compression. And then I go to Doppler the ATV, the anterior tibial vein. Now you can go to the front of the shin and then a little bit laterally. So get the tibia, go laterally, and you should be able to find the anterior tibial vessels there. Or, you know, if you can't see this view, or if you can't see this view, you can just Doppler right here. So this is anterior tibial vein with color Doppler and spectral Doppler. See, my box is straight on because the vein is dropping steep, and that's a good 60-degree angle. Beautiful. All right, now posterior tibial vein, same thing, transverse with and without color. Look at the striations on the muscle. It almost looks 3D. Another thing I've noticed, every transducer has great depth. Even the 24 megahertz transducer, I mean, obviously is limited in its depth, but it still has enough depth to see an appendix on an older, slender patient. That's impressive, and that's why there's also no autofocus on these machines, because the technology they used now allows for more penetration and doesn't require a focus because it has autofocus, and it just, I don't know, this just looks, it's like it's jumping on the screen. Also, I said that I didn't like the touch screen TCGs, but I'm already used to it. I love it. So with and without compression, the same thing, but with color. So the artery, 2 veins, and then just the artery there. And then sagittal. So usually you're going to have 3 vessels. You'd always see it better with color. So that's a vein, that's a vein, that's a piece of the artery there. Without color, with color. On some people, you can get this view extremely beautiful. This is decent. I had to actually struggle for these images. This isn't just pop out. I had to do a lot of little augmentations, scale down, scale up. Oh, I got to put the gain down because the scale went down. Now there's a lot of artifact. I had to really tweak it a lot just to get this image. And it's still, to me, it's not perfect. Could be way better. All right. So Doppler that. I only Doppler one of the veins. So then anterior peroneal vein, fibular vein, it's going to be deeper. All right. So dual screen, yeah. Where's their vessels there? I can understand why they want the color Doppler. So there, 2 veins, 1 artery, and 1 artery. And then in sagittal, that's actually a pretty decent picture. You actually have your fibula right here. So peroneal vein, peroneal artery, and then just spectral Doppler one of them. And then you could also try to get both of them. The more superficial one is going to be posterior tibial vein. And you'll have, I've seen people get these pictures, I get them too, and it's just, there'll be 6 vessels. The posterior tibial artery and 2 veins, and the peroneal artery and 2 veins, and it's just a real pretty picture. So that's kind of it there. And then over here by the bifurcation, I went back up and took it. So vein, artery, you can't really see two veins. And then I took the radiant flow on, put the color Doppler, but still left a lot to be desired. And I switched down to the 9 megahertz transducer. All right, so then finally, I go down to the ankle because that's what the order was for. They had swelling in the ankle. Usually when they order a venous Doppler for swelling of the leg, you do the venous Doppler. And if they have any discoloration or actual edema, you just scan that like a soft tissue focused on the area. Sometimes they just order the soft tissue by itself, but today they ordered the venous Doppler, I guess because of the history. So ankle, and there was a little bit of effusion, so tiny bit of effusion. Whenever I see that, I'll just put some calipers there, measure the AP diameter. That's it. I don't measure the length or anything. And then I put color Doppler on it. So there it is again. So now I've changed back to the 24 megahertz transducer. And you can see the capsule there. You can see this is a little bit of fluid. And also you'll be able to see I think this is the tibial tendon, posterior tibial tendon. I could be wrong, but it's definitely a tendon. And then you can see the edema. So you go, little echogenic fat, cobblestone appearance, and interstitial fluid. Every time I ever see any soft tissue stuff, I like to do panoramic views. So this is not a great panoramic view, got a little squiggly there, but you get the point. Always put color Doppler on there too. And yeah, so once you have that, you want to compare it to the opposite side. Look at the tendons, how beautiful. See a little bit of color Doppler, and then compare it to the other side. So here's a clip that I took there. I'm pressing on the actual little fluid collection to show that it moves. So then you have the left tendon right there. No edema or anything. And then I'm transverse. There's your tibia and fibula. Tibia and fibula. And then do a dual screen to compare. And that's pretty much it. And then to finish these exams, we always do one image of the common femoral vein with compression, with grayscale, with color Doppler, and spectral Doppler. And that's pretty much it. So I hope you guys enjoyed this. This is with the GE LOGIQ E10. It's a great machine. I'm loving it. I've only used it for 4 days. We only have one. We have maybe like 9 other GE LOGIQ 9s, older LOGIQ 9s, and newer LOGIQ E9s. The LOGIQ E9s are really good. The LOGIQ 9s are good too. They're still really good machines. They're old, so they pause a lot and they freeze, and it's really annoying because I'm hyper as hell and I want to do my stuff real fast, and I'm there waiting for the machine to finally take the picture or change screen or whatever. But this machine is amazing. I'm absolutely in love. I love everything. I love the autofocus. I don't care about the TGCs anymore. I thought I would miss it. I don't. I thought I'd miss the focal zones. I don't. This is the future. It's great technology, and I can't wait to see where we go from here. All right, so thank you for watching. Take care. Bye.